very weak, you always wanna have suction handy.
No.
So that if something does go down the wrong pipe, or they're having trouble, you can suction it out, okay? And it just goes in their mouth. You know, it says tonsil tip, that doesn't mean you go all the way to the tonsils. Alright. Okay, so now, next thing would be shaving. And I wanna make a point before I go on. Yes. This is a handy thing, this emesis basin, but is this a safety item? I could just kinda let him dribble it in a towel if I wanted to, couldn't I? Alright. The safety item is the yonker. Alright, okay. So next thing for a male, and I have shaved females' legs in ICU when they were there a long time, just because it made them feel better. Not something you wanna have to do all the time, but some women just don't feel clean if they haven't shaved their legs. Austin, you don't have so much a problem here. Anyway, because we're all liberated, okay? But the next thing would be doing a shave. What's the safety issue with shaving?
Make sure
Make sure you don't nip up.
If they're on a blood thinner, right? Or if they have a bleeding issue. What is it? All I can ever think of is Huntington's chorea, and that's not right. The blood disease that they're born with, that they bleed really
They
easy.
do, and it creates bruises in your thing.
Hemophilia, that's it, yes. I'm having senior moments today. Anything like that. Even aspirins thins your blood, but that's not so thin that they can't shave. So if they're on a blood thinner, that means we have to use the electric razor. There's not a whole lot to worry about on that. Just make sure that you shave against the hair growth because it shaves better that way, so it doesn't take you so long. If they have a pre-shave that you can put on there, it makes it work better. And then they need aftershave because their skin will break out a lot easier. If they are on a blood thinner, you're using the safety razor. Sorry.
You aren't.
You aren't. If they aren't on a blood thinner, thank you, y'all keep me straight. If they aren't on a blood thinner, you can use the safety razor. I would avoid it because these things are not safe. If you've ever tried to shave with one,
Yeah.
You go fast.
you know, they're safer than the old straight razors that guys used to use
Yeah.
and sharpen on the leather strap. Y'all have never seen that, have you?
Oh, yeah, yeah.
My granddad used to shave that way every day.
Some of us have a background.
You know, I can't, you see it in cowboy shows now. Anyway, so I'm gonna use this, but for this, I wanna wet their beard with a warm cloth. Just kind of put it on their face, not over their nose. That softens the beard, then you can take it off. You put on the shaving cream and use your safety razor and then wash off their face, okay? And you see how I've kind of got everything here on the table that I needed? Now, I finished with my razor and my comb and my oral care stuff. So I'm gonna put this all away. So I have a clear space to work. And I'm just gonna put it right here. But, oh wait, I forgot this gentleman has a hearing aid.
Oh, goodness.
How do we clean a hearing aid?
With the dry.
Yeah, this is my hearing aid, cause we don't have one
Okay.
to show, and this was to remind me to do it. So the hearing aid, you want, turn it off. That's the older ones. The newer ones don't have to be turned off.
Right.
So ask the patient, okay? The important thing to remember on hearing aids is to make sure you only use a dry cloth, because water getting inside there breaks them, and so they don't work right, okay? Then when you put it back in, you wanna make sure that it's turned back up and they can hear. And the way you test for that, you say, I'm gonna say a word and I want you to repeat it, okay? Then I turn around where they can't see my face, so they can't read my lips. Apple brown butter. No, I don't say that right.
Yum.
And then I have them say it
Come on,
after me,
one
something
word.
silly, you know? Giraffe skipping down the hollow, I don't know. But
Yeah,
anyway,
all day.
so anyway, they repeat it to me and then I know that's a safety thing that I do there. All right, so now I can remove my towel. I'm gonna put my rail up. I would probably, don't need to change my gloves, but I'm gonna get fresh warm water, okay? Cause I use that, well, I probably would cause I shaved. I change my gloves, wash my hands real quick, get fresh warm water. Usually we put a little soap in the water. It's a thin amount, so it's not making a lot of suds and you don't have to rinse. The soap, as it dries, that's how it kills the bacteria. And plus that saves you a lot of work. I learned real quick, you don't wanna lather them up
Right.
because then it's gonna take you 3 times as long to get it all washed off. So I got a little bit of my soap in there. I've got my water in here, or,
Question.
yes.
Oh.
Oh, I'm
No,
sorry.
no, you're okay. How many pumps of soap, from your experience, do you kind of like? Or just
Look at the
eyeball it?
bottle
Okay.
and follow those directions.
Oh, okay.
But in the hospital here, you're not even gonna use water and soap.
Okay.
You're gonna use what they call bath in a bag.
Yep.
They're pre-moistened like baby wipes. You warm them up in the microwave, follow the directions, because microwaves can really heat things up.
Yeah.
And they get hottest in the center first. Okay? But watch that and make sure, and then I probably lay my package in there. Don't open them up and dump them in a bath basin. But lay my package in there or put it in a towel so it helped keep them warm as I was using them. And then you use 1 wipe per body part, okay? All right. So if I'm using water, then I'm gonna come over and I'm gonna ask them to feel the water and make sure it's not too warm for them or it's not too cold. And then I get ready to give them a bath. And the first thing, and I'm gonna get rid of this because it makes me work harder. I'm gonna slip their arm out of the gown. Now he doesn't have an IV, so it doesn't make any difference which one I use, does it?
Right.
Okay.
But if he did, you take the IV one up
Yes.
first.
Put it on.
And on Our Lady over there where I'm doing an assisted bath, I'm gonna show y'all how to do that, okay? But then I like to just use the gown to cover them up because that gown's already warm.
Right.
And then I have my towel here. Gown up. And something else, I always forget to do this for y'all, I apologize. Before you start washing their body, you wanna take the blanket and fold it down to the foot of the bed and over. If the blanket isn't soiled, we're gonna reuse it. If it's soiled, then just do like normally. So now he's covered up with a sheet. At Brack, and I guess that would be Del Seaton now, we had bath blankets. You still have the bath blankets? They got rid of them? What do y'all use now?
Towels,
Ah,
a big towel.
that's a shame because bath blankets really are nice.
Poor thing.
Oh well, okay. Pining for old times.
What are bath
Y'all want-
blankets?
A bath blanket's
Used
like
to be
a
dope.
sheet-sized blanket.
Yep.
It's kind of fuzzy like flannel,
Gotcha.
and you can cover their whole body with it, and you kind of use it to help dry them.
Gotcha.
And we would use them for blankets. If anybody else wants to get a chair so they can sit down,
Sorry.
go for it right now.